community comes from a place of togetherness.
Community means family to me. It means having a group of people who support you and who have your back.
There's familiarity and trust for sure, but it's not this concept of like everybody has to get along, everyone has to agree. In fact, community to me is being different and coming together and learning from each other anyways.
Is embodying the words of Desmond Tutu. He said, Africans, we have this thing called Ubuntu. It is the essence of being human. We believe that a person is a person through other persons, that my humanity, your humanity is bound up all together, and that a solitary person is a contradiction in terms. Therefore, we must work for the common good, because my humanity, your humanity, comes into fulfillment in belonging and in community.
The success of community is based on communication and collaboration and recognizing that not everyone has the same resources and the same ability to take care of their families, and it's the responsibility of those that can to be able to help to reach out to those that can't.
Healthcare should not be determined by your zip code. It should not be determined by your gender or by your background or how much money you have in the bank. Everybody deserves access to quality healthcare.
So many people are forgotten and underserved, and there's so many people that don't receive the health care that they need.
If you come from the underserved area and having to live through when you don't even have access to see a doctor, and if you see a doctor, it may be somebody that you are not, you just don't feel comfortable enough to share some part of your life experiences that actually have an impact on your care.
The most important thing for people to know about PNWU is that they truly are putting the words of their mission into action.
I think PNWU offers hope.
Hope for a better world, hope for better health care.
And giving hope to people like me who have been told their whole lives, you can't be a doctor because blank.
As a first generation, college student myself, I know the kind of opportunities that education opens up.
There's a lot of people out there who want to help, who aren't really given the opportunity to, but there's a lot of people out there living in these small communities who want to go out and learn so they can return and help the people that helped raise them.
We want those that are committed to what we're attempting to do here.
The students at PNWU are not really traditional students. There are some people that go to college and then go straight to medical school out of it, but a lot of my classmates were a little bit older. They had other type of work experience.
We've got the program for you because we're focused on those types of students and their needs and their ambitions and desires.
And the school has given us that hope as well.
So that's all we had when we opened up the university was hope. We had a little bit of money, enough to get open, but we had a lot of hope.
Everything that PNWU has brought to this community, not just from a training future providers standpoint, but look at the jobs that it's created in this community. You talk about revolutionizing community health. It's brought in high-level people from all over the country to Yakima.
Our graduates go on to impact policy, create policy, and really influence change at the most incredible of institutions.
We're meeting our mission. So our mission is not a set of words. Our mission is a call for every single person on this campus, and we're meeting it in a measurable way.
And to put the percentage of medical students that we are placing in rural communities, that is revolutionizing community health. But I would say that we go deeper, and in the fulfillment of that mission is a journey. It's a long journey, and it doesn't happen overnight.
So in 10 years, we're going to look dramatically different than what we look now, because we're really initially building that university still. We're still sort of creating the interprofessional team that's needed in the community.
When a lot of people think of medical education, they think of the traditional model of the patient and the physician in one room talking to each other, right? But the complexities of healthcare now is that you are never alone.
But you need the interprofessional healthcare team, because the physician is an important part of that team, but they're not the whole team. They need the physical therapist, they need the occupational therapist, we need the dentist, the primary care dentist who's actually in the community, and the medical dental integration.
Healthcare is all about collaborative care. It's all about many different eyes and brains looking at something and seeing all the parts.
Anyone who has tried to access healthcare services at some point in their life has run into the frustrations of having a healthcare team that didn't talk to one another.
Medicine is team-based. You don't do anything entirely on your own without other health professionals in some way or another working together. And so if you're going to practice in that type of environment, we have to educate them in that environment.
It's helping educate everybody here and help people see the expertise that the PT, the OT, the DOs all bring together.
We need to continue to build our campus so that we can respond to that need.
That's what we're building here.
The campaign allows us to extend the good work at PNWU to all communities, and we want to get people engaged in that. We want them to be part of the development of the university going forward. It was important for the community to support us to get started, and it's even more critical as we expand the university and extend our services. Because we're a community-based university. I mean, we wouldn't be here without the community. We rely on the community as we train and develop healthcare professionals. We are community-based. We're a grassroots nonprofit university that was built from the community with the community's support and guidance and vision. In order for us to continue to meet our mission, we need other people and we need the community to support us. We can't do it on our own. So that's a big vision, but it is absolutely within our reach. We're a young, humble university, started from very little, and we still have that feeling like we can make it happen. I mean, nobody can get in our way. Change is possible. We're optimistic about the world. We're optimistic about our mission. And that is important. There's a lot of disaffected people out there who don't believe in institutions, and they should believe in PNWU because, we have a relatively simple message. We're going to educate and train healthcare professionals who go out and serve underserved and rural areas and pay attention to the forgotten.
Our communities.
Our communities.
Our communities.
Our care.